Hello and welcome to the online training module on placement stability in foster care. This training is a collaborative effort between a New Family Services, formerly Path Wisconsin, Inc., the Gamble-Skogmo Land Grant Chair in Child Welfare and Youth Policy, and the Center for Advanced Studies in Child Welfare at the School of Social Work at the University of Minnesota. This training module is part of an online training effort that covers a wide range of topic areas in child welfare. In this module, I'm going to talk about promoting placement stability in foster care, which includes a comprehensive review of the current research findings in this area. After completing this learning module, you should have an understanding of the importance of promoting placement stability in foster care. A review of current research on this topic will be discussed, after which you should have a general knowledge of the risk and protective factors linked to placement stability in foster care. You should also leave this learning module with a broad understanding of how the research findings can be applied to child welfare policy and practice to prevent placement disruptions. The field of child welfare is charged with ensuring the safety, permanency, and well-being of children in their care. Placement stability is one key aspect of permanency that has a significant impact on outcomes for youth well-being. Placement stability helps ensure that children's educational, physical, and mental health needs will be assessed and addressed in a timely and consistent manner. A cycle of instability may be created by placement disruptions. The number of previous placements for a child is positively correlated to later placement disruptions. Even for children who do not exhibit behavior problems initially, an increased number of placements predicts an increase in behavior problems, both externalizing behaviors such as aggression, running away, and outbursts, and more often overlooked internalizing behaviors such as withdrawal, depression, and isolation. The link between placement disruptions and youth well-being highlights the need for better understanding of factors in child welfare practice and policy that promote placement stability. This summary of current literature on promoting placement stability in foster care identifies a few factors that might help to break this cycle of instability. This comprehensive review of the research on promoting placement stability in foster care indicates a complex array of intersecting variables acting as either protective or risk factors for placement stability. This presentation provides a summary or a roadmap to help identify key findings from the literature. The findings are organized here in two parts. The first part outlines the risk and protective factors for placement stability, which include the characteristics of the child, the foster parents, the caseworker, and the agency. The second part of the presentation highlights a few key points at which child welfare agencies can shift practice and policy to help promote placement stability. This literature review examined evidence-based practices that have been shown to be effective in promoting placement stability. The criteria used in the literature review are adapted from the California Evidence-Based Clearinghouse for Child Welfare and are listed here on this slide. For this review, the term effective practice is used to describe an intervention that has had at least two rigorous controlled studies that have found the practice to be superior compared to the practice in the control group. A promising practice has had at least one study using some form of comparison group. An emerging practice may be generally accepted in child welfare practice as appropriate for use with children and families, but still lacks adequate research to determine effectiveness of the practice. Level 4 describes an intervention that has been evaluated by at least two controlled studies that found that outcomes did not improve compared to the control group. A concerning practice has had multiple outcome studies that suggest the intervention has a negative effect or increases risk of harm to clients served. The California Evidence-Based Clearinghouse for Child Welfare website contains a wealth of information about evidence-based interventions in many different areas of child welfare. Click on the link at the bottom of this slide to explore a variety of practices and topics. In this literature review, evidence-based practice is also defined in a holistic way, using Gilgan's 4 cornerstones as a foundation. These 4 cornerstones include research and theory, which was discussed in the previous slide, but also includes practice wisdom and experience of the child welfare practitioner, the person of the practitioner that includes their values and worldviews, and the person of the client and the experiences, values, and context that they bring to a situation. All of these factors are important to consider when implementing evidence-based practice. Now we begin to look at risk and protective factors. In looking at characteristics of the child, behavior of the child is cited as the strongest predictor of placement disruptions. This is particularly true for children exhibiting externalizing behaviors, such as disruptive, aggressive, or dangerous behaviors in the foster home. Another child-related risk factor for placement disruptions is longer stays in foster care. Several studies indicate that the first 6 months of a placement are crucial, as 70% of disruptions occur within this time frame. The age of the child is another risk factor, with older children at greater risk of disruption. Foster parents are a crucially important component in placement success. The foster parent's ability to deal with a child's problem behaviors is linked to the stability of the placement. Research indicates that the most common reason for foster parents requesting removal of a child from their home is difficult behavior of the youth. A protective factor for placement stability is the goodness of fit between the foster parent and the child, which includes a match in temperaments and having a relationship that is described as close. Social support in the foster family is another important factor in predicting placement stability. Foster parents who have at least 3 good friends in their support network are more likely to have stable placements, and foster parents who have strong ties to their own extended families are also more likely to be successful. Much of the research highlights the importance of the relationship of the caseworker to the foster parents and child, including the amount of time spent with the family and the ability to build rapport. Characteristics of caseworkers also affect placement stability for youth in care. For example, in one study, children assigned to caseworkers with a master's degree in social work spent significantly less time in care compared with children not assigned to an MSW-level caseworker. The research also indicates that low caseworker turnover is correlated with a lower number of foster care disruptions, as caseworkers were shown to make less contact with foster parents and children when turnover was high. This places foster children who were assigned multiple caseworkers in a double bind. Not only did they receive fewer contacts and less support overall, but they may also lack the opportunity to establish strong relationships with any one worker. Length of time in placement, the type of placement, and the degree of initial stability in foster care are critical issues in promoting placement stability. Studies indicate that the first 6 months of a placement are crucial. As mentioned earlier, 70% of disruptions occur within this time frame. Administrative decisions also impact stability. According to one study, the vast majority of placement changes were made to implement procedural, policy, and system mandates. For example, changing placement to move a child with relatives or a sibling, agencies moving a child from one transitional placement to another, or the use of emergency placements for children. This finding suggests that placing agencies might want to further examine policies that could exacerbate placement instability and advocate for policy change when warranted. The type of placement also has an impact on stability. For example, both kinship care and treatment foster care have been linked to greater stability for children. Now we will look at practice implications. The findings from the literature indicated that youth behavior is significantly linked to placement disruption. This suggests that early assessment and effective intervention is needed to support the needs of all youth in foster care, particularly for youth with significant emotional or behavioral needs. The literature also indicates that many disruptions occur within the first 6 months. This implies that the first 6 months of placement provide a critical window of opportunity for child welfare agencies to support both foster parents and foster youth. Also key is the foster parent's ability to address the child's behavior and to support the youth. Training and support for foster parents are essential in meeting the children's needs and preventing the escalation of behavioral and mental health concerns that can lead to disruption. Another significant support for foster parents is to help ensure that they have their own social support through extended family and other foster parents. Caseworker retention is also a key area for child welfare agencies to consider. In a study by the Child Welfare League of America, strategies that were found to increase caseworker retention included supportive supervision, job flexibility, and for some positions, recruiting social workers with specialized education in child welfare practice. Recruiting foster parents who can meet the specific needs of youth in out-of-home placement is of critical importance. Recommendations from the literature include engaging current foster parents and professionals in speaking together to potential applicants, and to focus recruitment efforts on diverse families and communities. Family and friends of prospective foster parents also play an important role, with many applicants stating that observing positive foster experiences of their extended family or friends help them decide to also become foster parents. This suggests that it may be helpful to target recruitment efforts among family and friends of current foster parents. Better screening and assessment of foster parents and better matching of children and foster parents is also linked to increased placement stability. The Casey Foster Applicant Inventory, the CFAI, is one example of a promising assessment tool. Pre-service training is also widely used as a tool to help people decide whether or not they want to become foster parents. Foster parent retention is also linked to placement stability. Retention is correlated with the quality and amount of support foster parents receive from caseworkers. Foster parents also highlight the importance of support from their own extended families and from other foster parents. Research further demonstrates that foster parent retention is increased by including foster parents in decision-making, showing respect for their work, and ensuring the cultural competency of agency staff. Financial support has also been linked to retention, with even a moderate increase in foster parent stipends of $70 per month in one study that was associated with increased retention rates of foster parents. Many studies have suggested that foster parent training is one way to help prepare foster parents to manage high-risk behavior in children and to avoid disruption. However, studies evaluating the most widely used foster parent training programs, such as MAP and PRIDE, have yielded mixed results. There is some evidence to suggest that hands-on support and ongoing training may be more effective models for foster parents than traditional classroom training. More research is needed on foster parent training curriculum that effectively improves foster parents' ability to address children's difficult behavior. Online trainings have also been shown effective for training on specific topics. The findings from the literature highlight several key strategies for child welfare agencies to consider in supporting foster parents. The first strategy involves improving foster parent recruitment by including clear messages about the current and specific needs in each community. Recruitment efforts may also be strengthened by recruiting friends and family of current foster parents. Developing standardized foster parent training curriculum is also needed that specifically supports foster parents in meeting the increasingly difficult behaviors of youth. Models that include hands-on, experiential learning, and ongoing coaching may be more effective than one-time training models. Joint training for social workers and foster parents also show promise by promoting team decision-making and a shared vision and philosophy. Interventions that have been shown to be effective in supporting foster youth and families include the models listed here on this slide. Wraparound services is a model of intensive, multidisciplinary support for families. In many empirical studies, wraparound has been found to be effective in reducing placement disruptions. Attachment-related services show promise in helping infants and very young children establish healthy attachments by working with children and their caregivers. Parent-child interaction therapy is a home-based model that works with caregivers and children together through therapeutic feedback and coaching of parenting skills. Therapeutic day treatment for preschool children has also been shown to be effective in promoting placement stability. Very few comprehensive models of practice have been empirically proven to promote placement stability. One model, however, that has been widely researched is the Oregon-based multidimensional treatment foster care program. This model appears to be effective in maintaining placement stability for older youth with severe and emotional behavioral issues. Research on the early intervention foster care, a program for younger children based on the MTFC, and now called MTFC Preschool, also indicates improved placement stability for younger youth experiencing emotional and behavioral problems in foster care. More research is needed on specific interventions to more fully understand which child welfare practices are effective in promoting placement stability. This slide presents a summary of the findings of the literature review and discusses implications for practice and policy, focusing on areas of child well-being, foster parent support, and agency factors. In looking at child well-being, in order to ensure that the emotional and behavioral needs of youth are met, early assessment of youth and care is key, particularly in the first 6 months of placement. Another important aspect to consider is the use of evidence-based interventions, such as the ones just mentioned in this module. Also, at least one study found that disruption rates were more than double for African American youth compared with youth of other races. This finding highlights the need to ensure that the cultural needs of all youth are met while in care, including the cultural competence of foster parents and social workers. Results of the literature review also suggest that children in foster care do better when they are connected, and so child welfare agencies can promote connections to parents, siblings, and extended family. In looking at ways to support foster parents, teams of staff and current foster parents have been found to be effective in recruiting, particularly when they share the real experiences of fostering to help foster parents and prospective foster parents know what to expect. Once recruited, foster parent retention can be increased through peer support meetings, respite care, team decision-making, and mentoring. Training models are also needed that can help foster parents address difficult behaviors of youth. In looking at agency factors, child welfare agencies can consider placing one child in a home when warranted, as well as reviewing policies regarding emergency and initial placements to minimize placement moves of any length. Social worker retention is also key in promoting placement stability, which can be increased through effective supervision and training, adequate salaries, and job flexibility. This presentation was based on a comprehensive literature review on this topic, which includes a review of the risk and protective factors related to placement stability, an annotated bibliography on the topic, and a user's guide to evidence-based practice in promoting placement stability. The full report can be found at the Center for Advanced Studies in Child Welfare's website, which can be accessed by following the link on this slide. As part of this module, please take a moment now to review the executive summary and the literature review, which can be found on pages 1 through 32 of the report. On this slide is also a link to the website for A New Family Services, the partner agency in this collaborative research project. Also note that all of the citations listed in the script of this module are also available in the full report mentioned here. The research on promoting placement stability in foster care indicated a complex array of intersecting variables. This presentation provided a roadmap to help identify key findings from the literature. In this training module, we discussed the importance of promoting placement stability, the risk and protective factors for reducing placement disruptions, and discussed a brief overview of some steps child welfare agencies can take to increase placement stability for youth. In summary, research suggests that any plan developed by foster care agencies to promote placement stability should be comprehensive in order to achieve safety, permanency, and well-being for each child in care. This can be achieved by working directly with youth, supporting foster parents, training qualified and committed caseworkers, and examining agency policies.